Welcome back. Time now 15 minutes past the hour. You know, this is Take a Friend to the Doctor Month, and joining me now to talk about staying healthy and the flu shot and getting flu shots is my favorite physician, Dr. Timothy Quinn. Good morning, Doc.
Hey, good to be here.
I appreciate you. You didn't have to operate on anybody last night, did you?
No, none of that.
Okay. Well, Doc, we were just talking about the flu shot and how important it is. Mm-hmm. Is it really important to get the flu shot?
It is, because the thing is, the flu, man, it could put you down for a while. And, you know, you're young and everything, but...
You heard that? You heard what Doc said?
Well, you're young and healthy. You got a good immune system. But for those out there, you know, that might be a little more senior, you know, their immune systems they're not quite as strong as, you know, yours or someone else's. But it's still a good idea to get the flu shot, because if you catch the flu, then you could spread it to a loved one, like a mother or a father, or maybe somebody with a compromised immune system with, you know, diabetes or whatnot. So it's a good idea to go ahead and get that shot.
Now, we were talking about this a moment ago. Some people think that if you get the flu shot, and I thought this too, if you take the flu shot, you can still get the flu.
Well, you can, but because here's the deal: the flu shot or the flu vaccination is pretty much, you know, it's a portion of the most common strands from the year before. Mm-hmm. The CDC, you know, they study what are the most common strands, and then they make the vaccine for the following year. Mm-hmm. Sometimes there could be a mutation where there's a different strand. So if you get the shot and then there's a different flu virus, you know, out there, then you could possibly get the flu. But the bottom line is it's still a good idea to get the shot, because there is some protection. Mm-hmm. Now, the deal is the shot, it usually takes about 2 weeks for your body to build up the immune response to fight it off. So you could even be exposed to the flu right after you get the shot, and then you could get the flu. But it's still a good idea to go ahead and get that shot.
Well, why is this part of the year the flu season?
Well, I mean, it's just when the virus is most prevalent, you know, out there in the environment. Mm-hmm. It starts around October, and it goes all the way through about April or May of the following year. So, you know, it's a good idea to go ahead and get the shot now, because it takes about 2 weeks for your body to build up that immune response, and then you're protected.
Okay. So now, if we do get the flu, what do you see? Because I've had it before, so I just, you know, suck it up and lay down.
Do that. Nah.
Do you have to go to the doctor?
Well, you don't have to go to the doctor, but the most common treatment is Tamiflu. It's an antiviral medication. But if you don't start the medicine within about maybe 2 days, 48 hours, it's not very effective at all. Mm-hmm. So if you start getting like a little itchy throat, runny nose, feeling a little body aches, go ahead and go to the doctor so they can go ahead and get you on that medication so you can, you know, get better.
You know, I had that here about a month ago, but, you know, they kept telling me, you got to come to work. You got to come to work. So I was here, you know, I was puny.
Right.
But so when you feel like you're getting this, you need to take care of it.
Yeah, go ahead. Don't hesitate, because, like I said, you know, if you you know, let the flu, you know, go ahead more than 2 or 3 days and start the medicine, it's not nearly as effective. But if you start the medicine really early on, hey, you know, you'll be back at work doing your thing.
Well, Doc, are there any other things that you could take to stay away from the flu if you don't take the flu shot?
Well, you know, like if, you know, we talked about people with a compromised immune system, say they have like asthma, COPD, like chronic obstructive pulmonary disease, you know, diabetes, kidney problems. You know, if you have somebody like that, you want to stay away from people with the flu, because you can't fight it off as well. Go ahead and get that shot. Now, here's the deal. You can also take what's called prophylactic treatment. Say, for instance, your wife gets the flu, right? And you know, you can't tell her to go stay in another house, you know. But the deal is, your doctor could actually prescribe you the Tamiflu, where you take it once a day as opposed to twice a day, and it'll help protect you from getting the flu if you just have to be exposed to someone with the flu.
Okay. Are there any things that you could eat to stay safe, like fruits or anything like that? Because I heard old folks say, if you eat a lot of oranges and pears, and you won't get the flu.
Well, I mean, the thing is, there's not a particular food. I mean, the wise tale is you eat an orange every day. The vitamin C will help you.
That's right.
But the main thing is, you know, you just want to try to, you know, get a lot of rest, you know, plenty of sleep, and, you know, just eat healthy. And the healthier you are, you know, the more you can fight it off, because your immune system will be strong and ready to go to war for you.
You know, Doc, this is great. I mean, you really should charge us for giving us this advice. But what are other things that we can do to stay healthy?
Well, the main thing, like I said, is, you know, a lot of people don't get a lot of rest anymore. You know, when you're tired, you're sleeping, you know, less than 7 or 8 hours a night, your immune system is going to be compromised. And, you know, your immune system, that's your body's way of fighting off, you know, different things you come into contact with. So get a lot of rest. try to get some exercise in. You know, I'm a runner myself. You
Yes.
know, get that exercise, lift some weights, and that actually builds up your immune system. And I'll tell you another thing: stress. Keep your stress down.
You know, we have a guy here, his name is Keith Collins.
Yes.
And he gets no rest.
Right.
He's up all night. I think he's a vampire.
He might be. Well, I stay away from that, brother. That's a dangerous situation.
Well, Doc, I really appreciate you coming by this morning. Now, when you look at other tips, you always give us tips. You know, anything else that we need to know about staying healthy. Those are some great tips about
Right.
stress and getting plenty of exercise and all
I
that.
just encourage everybody to go ahead and get that flu shot. And, you know, like we were saying before we went on, most insurances pay for it at 100%. You know, you just, you know, let them know you can go to the pharmacy and present your insurance card, and most insurance will cover it because it's going to cost them more money if you get the flu. So they want you to go ahead and get that shot. So
Yeah.
you be healthy.
And you know, I think, wasn't there something in the, I guess, coming from the White House that, you know, there was an argument about getting the flu shot or getting immunization or something like that. Was that part of, is that something that's going on? People are kind of worried about?
Well, you know, there was something with little children getting the vaccinations. They thought it was linked to autism, but the research showed that there's really no link to it, you know. So the bottom line is it's a good idea to get your flu vaccination, and for your children, they should get vaccinated for different problems like polio and stuff. I don't know if you know, but we've pretty much wiped polio out, you know.
Yeah.
Back in the 70s, kids were getting polio, but since we've been doing those vaccinations, hey, the kid, you know, it's not really seen anymore. So they work. They really do.
You think they ever found a cure for cancer?
Hey, we're working. But let me tell you this now, cancer, there pretty much is a cure. Just getting diagnosed early. You know, getting your mammograms, getting your man test. You know what I'm talking about?
Well, see, now, Doc, I might end up with all kind of stuff because I ain't ever going to the doctor.
Well, I'm telling you, if the bottom line is like different screening tests, you know, like your PSA and all that.
Yes, sir.
If you have cancer, you catch it early. Hey, they can wipe it out and you're on your way.
Well, why are, you know, they say that African-American men
Right.
are scared to go to the doctor.
They are.
Why is that?
Hey, you know, the bottom line is us men, you know, we all muncho, you know, we don't need the doctor. But the bottom line is most medical problems, including cancer, if you catch it early. Like I had a man recently, he came to my office and, you know, we got him to do his wellness. He didn't want to do the man test, and, you know, the man test, that's where you know, feel the prostate, but we went ahead and did the blood. Hey, look, but the blood works. The PSA, the prostate-specific antigen in the blood, it came back a little bit elevated. We referred him to a urologist, and they did a simple procedure. He had cancer, but they caught it early. It didn't have a chance to spread. So, hey, he was cured.
How old do you have to be to get this? When you turn 50?
40
40?
years old. 40 years old is recommended that men go ahead and get their, you know, their male exam. Now, but what I'm trying to tell you is the research has shown you can do the PSA, which is just a blood test. And if you have prostate cancer, in most cases, it could be picked up early and your life could be saved. And that's a good option. You know, now it's best to do both, but for those men out there that just are not going to do it, at least do the blood test. And it's just simply drawing your blood, and hey, your life could be saved.
Well, with the prostate test, is there a way that you could send a kit to
the
us
house?
and then we could send it in? You can't do that?
No, not for that. Now there is a kit for the colon cancer screening where you take a stool sample, but go ahead and go to the Dr. Rob Jay. Like you said, when you get sick, they still want you to come to work because hey man, you
Yes,
bringing
sir.
information to the people, so we need you around.
Yes, sir.
Yeah.
Wow, man, you I know one thing. I would never be a doctor.
Right.
No, well, you're amazing. And,
Well, your job is difficult. I don't know if I can do your job.
oh, absolutely, you can, Doc.
But
But
it's a difficult job. You bring a lot of good information to a lot of people for a long time.
well, you do too, Doc, and I really appreciate
Right.
it. Anything we can do here to help you, man, just let us know. But I still want to advocate you sending us a kit, and we do it ourselves and mail it back.
Doctor in the box.
Well, thank you, Doc. I really
Hey,
appreciate it.
thank you for having me.
Yes, sir. Anytime. That's Dr. Timothy Quinn. Stay with us. More Metro Morning Live after the break.